The next question is on healthcare. We'll be starting with Sharon. While the Affordable Care Act, or Obamacare, has stirred up a lot of passionate debate over the years, Massachusetts' pioneering law has been in place for several years and remains generally popular, and we have the highest rate of insurance coverage in the country. One candidate for governor has called for a single-payer system. What do you see as the most pressing issue in healthcare in Massachusetts, and would you support a push for single-payer healthcare in the legislature?
Well, I definitely agree with that gubernatorial candidate. I definitely would support a single-payer system. I guess that would be basically Medicare for all. It would, by expanding the pool of people that would be insured that way by the state, essentially, we'd be decreasing the overall costs, spreading the risk. We would need to decrease we would be decreasing the overhead due to all the administration and the profits that private insurance companies now cause. We need to look to controlling all the cost increases in our healthcare system. Insurance companies don't necessarily have to lose business. Well, they probably lose some, but they could provide opt-in packages for those that wanted to opt in rather than take the Medicare, single-payer health care. And they could also provide competitive plans or supplemental plans.
Massachusetts is a leader in healthcare, and I am proud of the work that I have done as a health researcher in the legislature. In 2006, I was on the team that helped to draft the Mass Health Reform Law. That law became a blueprint for the Affordable Care Act, or Obamacare, which is changing the lives of millions of people through coverage throughout the country, and I'm very proud of that. The number one issue facing the Commonwealth is by far the cost of healthcare. We are number one in coverage, we are dead last in cost. Now, costs can't just be solved by obviously just slashing costs. Costs have to be examined with the patient at the center of better quality patient care, and there are really good models in Massachusetts of getting to better quality care and reducing costs. The governor has made some moves in that direction. Programs like the Commonwealth Care Alliance, which I work closely with, have been trying to move the insurance model more towards a patient-centered model. There's a lot more we can do in this area, and I'm excited to be a leader in that area. I am a strong supporter of single-payer health care. I'm glad that Vermont is leading the way in this, and they are scheduled to vote on single-payer, or to have that system by 2017. I think Massachusetts is laying a lot of the groundwork, and that we can learn from Vermont, we can learn from other places, and continue to move in that direction. What I know is that we need someone who can dig into the issues, have these hard conversations with the stakeholders in the health system and with the community to make sure that patients are still being served by the health system.